Understanding Autism, Causes and Treatments in 2025. A comprehensive exploration of autism spectrum disorder, emerging research, and breakthrough treatments shaping the future of care. What is autism spectrum disorder, ASD? Autism spectrum disorder is a complex developmental condition that affects how individuals interact socially, communicate, and behave. The spectrum nature means symptoms vary dramatically from person to person. Nonverbal individuals with intellectual disabilities. Highly verbal people with mild social challenges. Everything in between these extremes. ASD typically begins before age 3 and lasts a lifetime, though symptoms and capabilities can evolve with proper support and intervention. Autism's rising prevalence is alarming. 1 in 31 children today has autism. There is a dramatic increase since year 2000. CDC reports dramatic rise from 1 in 150 to 1 in 31 children diagnosed. Boys affected the most. This could be because males are disproportionately diagnosed compared to females. Better screening methods are available. Doctors use broader diagnostic criteria and improved detection methods. This dramatic increase is primarily attributed to identifying milder cases that were previously undiagnosed, along with enhanced screening protocols and expanded diagnostic criteria that capture the full spectrum. To analyze what causes autism, we have to understand genetics. We call it the genetic puzzle because hundreds of genes are involved. 1. Genetic foundation. Autism is primarily rooted in genetics, with hundreds of gene variants influencing brain development and neural connectivity patterns. 2. Inheritance patterns. Genes can be inherited from parents or arise from spontaneous mutations during critical fetal brain development periods. 3. Associated syndromes. Genetic conditions like Fragile X syndrome and Rett syndrome are linked to specific forms of autism spectrum disorders. 4. Personalized medicine. Genetic testing increasingly helps clinicians personalize diagnosis, intervention strategies, and treatment approaches. Environmental factors that interact with genetics. 1. Parental age. Advanced parental age, particularly fathers over 40, shows increased risk associations with autism diagnosis. 2. Prenatal factors. Maternal infections, diabetes, obesity, and autoimmune disorders during pregnancy may influence development. 3. Birth complications. Extreme prematurity, birth complications, and oxygen deprivation can contribute to autism risk. Important note: decades of rigorous scientific research have found no credible link between vaccines and autism. Multiple large-scale studies consistently debunk this myth. Recent controversy: acetaminophen use in pregnancy. The research debate about Tylenol and Panadol. Recent studies present conflicting evidence about acetaminophen, Tylenol and Panadol, used during pregnancy and potential autism risk. Some research suggests possible associations, while other studies find no significant link. What is the FDA guidance about Tylenol use? The FDA now recommends cautious use, which is the lowest effective dose for the shortest duration during pregnancy. However, pregnant mothers should take note that her untreated fever poses serious developmental risks to the fetus. Bottom line is always consult healthcare providers before making medication decisions during pregnancy. Diagnosis of Autism Spectrum Disorder, ASD. ASD begins in early childhood, so it doesn't suddenly develop in adulthood. But it's increasingly common for teens and adults to be diagnosed if their ASD wasn't recognized when they were younger. Diagnostic approach. ASD diagnosis is not based on a single medical test. It relies primarily on careful behavioral observations and a thorough review of developmental history. Genetic testing may be utilized to rule out or identify co-occurring conditions. Childhood screenings. The American Academy of Pediatrics recommends general developmental and behavioral screenings for all children during regular well-child visits. Regular developmental screenings are conducted at key milestones. General developmental checks are recommended at 9, 18, and 30 months, while autism-specific screenings are performed at 18 and 24 months of age. Comprehensive evaluation. A comprehensive evaluation is performed by a team of specialists, including developmental pediatricians, neurologists, psychologists, and psychiatrists. This process involves assessing against DSM-5 criteria, detailed caregiver interviews, and direct observation of the child. Adult diagnosis. Although ASD originates in early childhood, some individuals receive a diagnosis later in adulthood due to previously missed signs, misdiagnosis, or effective masking strategies. Adult evaluations incorporate personal history and, when feasible, information from family regarding early development. Autism Spectrum Disorder, ASD, signs and symptoms. Autism spectrum disorder primarily affects communication and social interaction, often involving repetitive behaviors and restricted interests. Onset typically occurs before age 3, though it may not be recognized until later in life. What are early childhood indicators of autism? While these signs often begin in early childhood before age 3, they might not always be recognized until later in life. Social interaction indicators. 1. Making limited eye contact or none at all. 2. Not responding to their name or making facial expressions to show different emotions by 9 months old. 3. Uses few to no gestures, such as waving hello or goodbye to mom and dad, by age 1. Shared attention indicators. 1. Doesn't share interests, such as showing you an object they like, by 15 months. 2. Doesn't point to things that interest them by 18 months. Emotional reciprocity indicators. Doesn't pick up on other peers' upset or hurt feelings by age 2. Imaginative play indicator. 1. Doesn't play pretend, such as imagining they're a superhero, by age 4. 2. Doesn't act, dance, or sing for you by age 5. Other signs, children and adults. Broader symptoms that may manifest in various age groups. 1. Speech patterns, delayed or absent speech, monotone voice, or accent. Speaks in an accent others find unusual, speaks very quickly or slowly. 2. Social awareness, limited awareness of their surroundings and others' feelings. For example, doesn't respond when their name is called, trouble with conversation turn-taking, often focusing on personal interests but doesn't ask much about others' interests. 3. Communication style, direct and honest approach, potentially missing social politeness, difficulty recognizing emotions, intentions, jokes, or sarcasm. Find it hard to express their own feelings in conventional ways. 4. Repetitive behaviors, echolalia, repeating words and phrases, stimming, hand flapping, rocking, spinning. 5. Sensory sensitivities, unusual reactions to sound, light, texture, taste, or smell. 6. Regression, loss of previously acquired speech or social skills. DSM-5 defines autism spectrum disorder, ASD, as a single diagnosis but recognizes differences in symptoms and severity. It describes 3 levels of support needs. Level 1, requiring support. Individuals at this level experience mild social and communication challenges, often struggling to initiate conversations. They may exhibit inflexible behaviors and require some assistance with daily life and relationships. While capable of age-typical language and cognitive skills, their social and behavioral differences necessitate some support to thrive. Level 2, requiring substantial support. This level is characterized by clear verbal and nonverbal communication difficulties and limited social interaction. Repetitive behaviors with intense focus and restricted interests severely interfere with daily activities, requiring substantial help from caregivers to manage and mitigate these challenges. Level 3, requiring very substantial support. Individuals at this level face severe communication and interaction challenges, often with minimal speech or nonverbal communication. Extreme inflexibility and repetitive behavior significantly impair daily functioning, necessitating intensive, and often 24-hour round-the-clock support to help them navigate daily life to ensure their safety and well-being. Breakthrough treatment, leucovorin for cerebral folate deficiency. 1. Understanding CFD. Cerebral folate deficiency (CFD) causes brain folate shortage, leading to autistic symptoms in some children through disrupted neural development. 2. FDA approval. Leucovorin calcium tablets received FDA approval to improve speech and social skills specifically in ASD patients with confirmed CFD. 3. Clinical success. 85% of treated patients demonstrate measurable clinical benefits in communication abilities and social interaction skills. Critical, treatment requires medical supervision and must be combined with behavioral therapies for optimal outcomes. Medication options for Autism Spectrum Disorder, ASD. Medications don't cure ASD or make all its symptoms disappear but can ease symptoms or co-occurring conditions. Medications can help someone manage the disorder that can co-occur with autism. Common types of medicines. 1. Antipsychotics. E.g., risperidone, aripiprazole, used to reduce irritability, aggression, hyperactivity, or withdrawal symptoms often associated with ASD. 2. Antidepressants. SSRIs help manage anxiety, repetitive behaviors, irritability, tantrums, and can improve eye contact. Tricyclics may address underlying depression or obsessive-compulsive tendencies. 3. Anti-anxiety medications. These medications are prescribed to manage co-occurring anxiety or panic disorders, providing relief from severe anxiety symptoms. 4. Stimulants. Often used to improve focus, reduce hyperactivity, and support executive functioning in individuals with ASD who also experience these challenges. 5. Anticonvulsants. These medications are critical for treating seizures or epilepsy, conditions that affect approximately 1/3 of individuals with ASD. What are the early intervention and behavioral therapies for autism? 1. Intensive early therapies. Evidence-based interventions during critical early years significantly improve language development, social skills, and adaptive behaviors throughout life. 2. Educational support. Individualized education plans and specialized support services are essential for academic success and lifelong skill development. 3. Integrated care. Co-occurring conditions like anxiety, ADHD, and sensory processing issues require comprehensive, coordinated treatment approaches. Therapies and supports for Autism Spectrum Disorder, ASD. Behavioral and developmental therapies. Applied behavior analysis, ABA uses positive reinforcement to build social, communication, and learning skills. Speech and language therapy improves communication, speech, gestures, signs, pictures, devices. Occupational therapy builds daily living and independence skills, may include sensory integration and physical therapy. Educational therapies. TECH, structured program emphasizing routines, boundaries, visual instructions, and demonstrations helps ASD learners thrive through consistency and visual learning. Educational support and services, US. Idea: Individuals with Disabilities Education Act guarantees free appropriate public education, FAPE, with special education and related services. IFSP, Individual Family Services Plan for Children Under 3, provides early intervention tailored to the child and family. IEP, Individualized Education Program for School-Age Children, outlines learning goals and services, legally binding and created with parents, teachers, and specialists. Empowering families with knowledge and tools. 1. Embrace the spectrum of autism. Autism presents diverse causes and manifestations. Understanding this complexity helps families navigate individual journeys with confidence and hope. 2. Scientific progress. Advances in genetics and breakthrough treatments offer unprecedented hope, though no single cure exists yet for this complex condition. 3. Community support. Early diagnosis, personalized care, and informed family choices create pathways to thriving. Together, science and community improve millions of lives. The road ahead in research provides hope. 1. NIH clinical trials. National Institutes of Health launching comprehensive trials to confirm leucovorin's safety and efficacy across broader autism populations. 2. Genetic studies. Ongoing large-scale genetic and environmental research continues uncovering new causes, risk factors, and potential treatment targets. 3. Public awareness. Comprehensive campaigns educate families and clinicians about emerging risks, treatment options, and evidence-based care approaches. What is leucovorin, the drug the FDA approved to treat autism? In late September 2025, the FDA approved the generic drug as a treatment for autism, a move that shocked health experts.